My name is Craig Spencer. I'm a doctor. I work in emergency medicine.
Dr. Craig Spencer became the first and only confirmed case of Ebola in New York City back in 2014. He contracted the virus while volunteering for Doctors Without Borders in West Africa. And the news caused a panic as health officials searched for anyone who might have come into contact with him. At a bowling alley, he was actually bowling with Ebola, spelled differently, on the subway and in his neighborhood. In the end, there were no other cases and Craig recovered, but the experience was traumatic nonetheless.
Seeing so many people die of this horrible virus, seeing the toll that it can have on the human body, it's impossible to describe the mental exhaustion. So in 2014, when I was in Guinea, I was there in September, October, when the case numbers were really, really going up. It's when you started hearing about patients at the doors of treatment centers that weren't able to get in. Our days were 12 to 14-hour days. Take care of as many patients as we can, try to teach other patients to help other people when we weren't able to be inside. Generally, you'd walk out through this whole process of being decontaminated. You'd pour out your boots and there'd be a liter of water, really, really dehydrated, really, really exhausted. At the end of the day, all you wanted to do was relax, maybe have a beer, have something to eat and go to bed, and then start it all again the next day. When I found out that I was infected, it was actually here in New York City. Being hospitalized for 19 days, at the time felt like forever and now seems like a blur. I had a really amazing medical treatment plan. I had a really great team that took care of me. But the thing that I constantly kept thinking back on was that whereas in the hospital I was taken care of, there were maybe 30 doctors always on call for me. In Guinea, when I was taking care of patients, I was maybe taking care of 30 patients myself. So I wasn't on social media at that time. I had closed all my accounts. I made a kind of an intentional decision not to follow what was going on in the media. I didn't know anything about Trump's tweet at that time. It's not anyone that I followed. It's a bit heartening to know that we've disagreed on nearly everything for at least the past 5 years. Personally, my experience has really been focused on highlighting the importance of public health. I was working on a search and rescue boat in the Mediterranean in 2017 and 2018. These are people, these are humans just like us. We need to do what we can to provide them with the services, and it may be healthcare, it may be pulling them from a rickety plastic boat in the middle of the sea. It may just be respecting their humanity. And I saw an inequality in that approach, both in West Africa as well as in the Mediterranean. We didn't really learn a lot from the last time. We didn't learn a lot from 2014 and the West Africa Ebola outbreak. We are seeing a very similar response in DR Congo now that we saw in West Africa a couple years ago. We're seeing almost the same mortality despite the fact that we have a vaccine that's known to be almost perfectly effective. So this should be concerning for how we respond to pandemics or viruses or bacteria with pandemic potential. You can't build a moat wide enough or a wall tall enough to keep out pandemic threats. It's going to happen. Should there be a disease that starts in China or Columbus or wherever it may be, it can be anywhere else in the world within a day or two. We are interconnected. There needs to be strong reporting systems with strong incentives and a good response mechanism. Otherwise, we're just leaving ourselves vulnerable to the next pandemic.